ప్రపంచానికి అతిపెద్ద ముప్పుగా మారిన అంశం వాతావరణ మార్పులు. కాలుష్యం వల్ల భూమి వేడెక్కడంతో వరదలు, తుఫాన్లు, క్లౌడ్ బరస్ట్లు, అధిక ఎండలు, తీవ్రమైన వడగాలులు, కరవులు అత్యంత సాధారణ విషయాలుగా మారిపోయాయి. ఫలితంగా ఆర్థికంగానూ తీవ్ర నష్టం సంభవించడమే కాదు, ప్రజల ఆరోగ్యంపై కూడా పెను ప్రభావం పడుతోంది. అయితే పరిస్థితి ఇలాగే కొనసాగితే మరింత ప్రమాదకర స్థితి నెలకొంటుందని యూనివర్సిటీ కాలేజ్ ఆఫ్ లండన్లో ఇన్స్టిట్యూట్ ఫర్ గ్లోబల్ హెల్త్ విభాగం సీనియర్ పరిశోధకురాలు డాక్టర్ మరీనా రొమానెల్లో హెచ్చరించారు. ప్రముఖ వైద్య జర్నల్ ల్యాన్సెట్ కౌంట్ డౌన్ పేరుతో వాతావరణ మార్పులు, ఆరోగ్య రంగంపై ప్రభావం 2025 అధ్యయనానికి ఆమె ఎగ్జిక్యూటివ్ డైరెక్టర్గా వ్యవహరించారు. ఈ నేపథ్యంలో ల్యాన్సెట్ అధ్యయనానికి సంబంధించిన మరిన్ని వివరాలు తెలుసుకునేలా రొమానెల్లోతో నేటి ప్రత్యేక ముఖాముఖి.
ప్రపంచంలో వాతావరణ మార్పుల ప్రభావం ఆరోగ్యం పైన తీవ్రంగా చూపుతుంది. ఇది ఏ మేరకు ఉంది అనే దానిపైన ప్రముఖ వైద్య మ్యాగజైన్ ల్యాన్సెట్ అధ్యయనం చేసింది. ప్రపంచంలోని 120 విశ్వవిద్యాలయాలకు చెందిన అనేక మంది శాస్త్రవేత్తలు ఇందులో పాలుపంచుకుని అధ్యయనాన్ని చేశారు. ఈ అధ్యయనం ఫలితాలు ఏంటి, ఎలాంటి సమస్యలు మనకు రానున్న రోజుల్లో ఆరోగ్యం పైన చూపబోతున్నాయనే అంశం పైన ఈ ల్యాన్సెట్ కౌంట్ డౌన్ ఎగ్జిక్యూటివ్ డైరెక్టర్ డాక్టర్ మరీనా రొమానెల్లో మనతో మాట్లాడుతున్నారు. ఆమెను అడిగి ఇందులోని ముఖ్య అంశాలు మనం తెలుసుకుందాం. వాట్ ఆర్ ద ఇంపార్టెంట్ ఫైండింగ్స్ ఆఫ్ ద స్టడీ ఆన్ దిస్ క్లైమేట్ చేంజ్ అండ్ ఇంపాక్ట్ ఆన్ హెల్త్?
Yeah, so the 2025 report of the Lancet Countdown on Health and Climate Change is the latest of our global assessment of the state of the links between climate change and health. And what we've seen this year is that the health risks of climate change have reached record new levels, record new threats to people's health globally across most of the indicators that we track. And we're seeing concerning trends when it comes to heat-related death, to exposure to infectious diseases or extreme weather events that are increasingly claiming lives, and importantly also harming the economy and claiming livelihoods.
So why climate change affects health or more in recent years? What are the causes?
Well, the causes of climate change we know for a fact that are human activities, are human emissions of greenhouse gases that warm the planet. And we know that the vast majority of those are coming from the burning of fossil fuels. And what that's generating is a very dangerous change in the climatic conditions on which our health, our well-being, our economies, our livelihoods depend. And we're seeing that despite very robust science of the health impacts of climate change, no least produced by reports like ours, emissions have reached record new high levels in the latest year of data. And perhaps one of the concerning trends that we've seen in the last year is that despite that body of evidence, key actors, key governments, companies, banks are increasing their oil and gas production activities and are increasingly threatening their future by backtracking even previous commitments made. So the world is tending towards an increasingly dangerous situation as a result of that.
So can you elaborate more on this subject?
For sure. Look, we've seen things like, for example, the biggest oil and gas companies in the world. We've analyzed the strategies that the 100 biggest oil and gas companies declare today to their shareholders. And we've seen that each year, their expansion of oil and gas is increasing. So they're now, as of March this year, on track to exceeding the levels of emissions compatible with the Paris Agreement, the globally binding commitments that countries made in 2015, by 189%. They will emit in the year 2040 189% more than is compatible with a livable future. And very similarly, we've seen, for example, the major banks around the world that are increasingly financing the expansion of oil and gas. And for the first time since the year 2019, they have increased the oil and gas lending after having decreased it for many years. The growth was 29% more lending to oil and gas from 2023 to 2024. And listen to this number, they're increasing by over 600 billion the lending to oil and gas. In comparison, the lending to the green sector, the green economy that we know is healthy, and we know that it's growing at a faster pace than the fossil fuel-based economy, has reached only just about 500 billion, so even less. And governments are also dropping commitments. We've seen it in the US, we've seen it in Argentina, where I'm from, and that is incredibly concerning. But amidst that, we're also seeing some positive signs, if you wish, some signs of key actors stepping up, and particularly local governments that are so in touch with local residents are still being strongholds for action and are still assessing the risks and planning to tackle climate change locally.
So who are the more vulnerable people for this climate change?
Yeah, there's vulnerable groups in every country. So, for example, elderly populations, adults over 65 years of age, or very young children under 1 year of age, those with underlying cardiovascular, respiratory, heart disease, lung disease, are particularly at risk from heat exposure. When these groups get exposed to heat, they are at an acute risk of very serious adverse health impacts and even death, because their bodies are much more vulnerable. And we're also seeing kind of vulnerabilities when it comes to those that are in less affluent parts of society, those that live in more informal housing. Obviously, these groups are very exposed to heat and to other extreme weather events. And one thing, for example, that is quite telling from our data is that the impacts of extreme weather events are growing and are increasingly costing the economy. We've seen in 2024 over $300 billion being lost from the global economy because of climate-related events. And the important thing here is that the vast majority of those losses are uninsured. So they fall on people's shoulders, either to replace the losses, or sometimes they go unreplaced and there are big, big losses. But when we look at how different countries are bearing those losses, those with lower human development index, countries that are the most vulnerable, that have least capacities to recover, and that generally have not significantly contributed to climate change, are being worst affected, with over 97% of all the economic losses being uninsured and therefore falling on local economies without a safety net. And that is impacting, obviously, people's incomes, people's livelihoods, and the economic conditions on which we know that health depends so strongly.
What are the impacts in India?
Well, India is one of the world's most vulnerable countries to climate change. And we've seen that it's a particularly hot country. It's a country that is very populous. And for example, we're seeing that each person in India in 2024 was exposed to about 20 days of health-threatening heat waves. And the interesting thing is that almost 70% of those heat waves would not have occurred if it wasn't for climate change. And what does this translate to? It translates to an increase in heat-related deaths as well. And we've seen not only heat-related deaths rising globally, but also the associated loss of income. Outdoor workers are particularly vulnerable to exposure to heat. Their health is at risk, but also their productivity falls. And what we see in India is that heat exposure has led to a record high, almost 17 full days per person of labor lost because of the strain of heat exposure on workers. That is over 100%, over twice the level that we'd seen in the 90s. And when we translate that to how it's affecting people's income, in India, we've seen a loss of almost $400 million in terms of those economic losses from exposure to extreme heat. We're also seeing kind of over 10,000 deaths from exposure to smoke from wildfires that we know climate change is making more likely. And we're also seeing the expansion of infectious diseases that are particularly affecting India. For example, the environmental suitability, the environmental risk for the transmission of dengue by Aedes albopictus, one of the mosquitoes that transmits dengue, has increased and exceeded the threshold of the R0, of the likelihood of transmission, being more than 1, which means that the transmission can become exponential. So it will be increasingly hard to control the transmission of mosquito-borne diseases as a result of this. And in all of this, one of the other things that we're seeing is that, sadly, in India, there's a big dependence on fossil fuels to meet energy needs. And as a result of the spike in energy prices, the Indian government resorted to subsidies to keep energy affordable to local people and avoid an increase in energy poverty that we know is a huge problem for health. But what that has resulted is that the government has been strained, putting almost 50 billion US dollars towards net fossil fuel subsidies, 50 billion US dollars that could have otherwise been used by the government to improve people's health and people's well-being if we could transition away from the dependence on fossil fuels locally. So the interactions between our persistent use of fossil fuels, climate change, and how that's affecting people are really complex, and they compound each other. They increase vulnerabilities locally and reduce people's capacity to cope with climate change and other health impacts.
How do climate change impacts on health affect maternal and child health?
Maternal and child health. Well, look, it's really one of those areas of study that is growing really rapidly is precisely the impact on maternal and child health. For example, we have data on the growing exposure of infants to heat waves that we know because particularly very young babies don't thermoregulate, don't control the bodily temperature as well as older children. They are at particular risk from heat exposure. But there's also other pieces of emerging research that shows that, for example, during pregnancy, heat exposure can increase the risk of adverse pregnancy outcomes, of stillbirth, of early birth, and of danger to the mother as well. And similar, we're seeing heat exposure to air pollution that also has been shown to affect the fetus before birth, and obviously very young children at a very high risk from from exposure to smoke as their lungs are developing, their body is developing, and this toxic exposure can undermine their health for many, many years. One of the other things that we're seeing that is affecting many parts of the world is an increase in food insecurity related to climate change. The increased incidence of droughts and heat waves, we have shown it to be associated with an increased number of people reporting severe or extreme food insecurity. And that obviously is particularly worrying for young children, as we know that food insecurity and mal or undernutrition during the early years of life can have permanent adverse effects on their health throughout their lifetimes.
Earlier also you have done some studies on this climate change impacts. What is the difference between earlier studies and present study?
Well, in the present study, we have refined much of our methodologies to assess the links between climate change and health. For example, we have refined the way in which we assess heat-related mortality or the mortality associated with wildfire smoke. And now we have a much more intricate and nuanced assessment of the situation of the actual burden of climate change on health. And we've also increased our understanding of how governments are responding, on how our energy grid is affecting our health and our well-being, for example, by refining the assessment of exposure to air pollution that comes from the burning of fossil fuels, particularly dirty fuels like coal. I know that that is a big problem in India, and I know also that the Indian government is putting a lot of effort in increasing access to clean energy because of the huge burden of disease and of mortality that is associated with the dependence and the persistent use of these dirty fuels. So we have refined all of those analyses and now have very clear data that show that the opportunity of climate action vastly exceeds the costs of action, and that it could save millions of lives every year.
What are the major strategies to mitigate the health impacts of climate change, such as reducing greenhouse gas emissions or improving public health infrastructure?
Yeah, so we have vast evidence that tackling climate change, particularly through activities that simultaneously benefit health, could save millions of lives. So just to give you some examples, and particularly I think India has a huge opportunity here. In India, much of the grid is dependent still on fossil fuels. Coal makes up over 40% of all of the Indian energy, more than 70% of the local electricity, and almost 60% of the energy that people use in their homes comes from very highly polluting solid biofuels in India, which means that locally there's a huge exposure to air pollution that comes from the energy sector. What this translates to is over 1.7 million deaths that today can be directly linked to human sources of air pollution, of outdoor air pollution in India. And that coal has led to almost 500,000 deaths from air pollution. These deaths could all be avoided by transitioning to clean renewable energy. That again, I know the Indian government is investing a lot in clean renewables. So we could save about 1.7 million deaths by reducing those sources of air pollution and transitioning to non-emitting sources of energy that could simultaneously help tackle climate change. And in our report, we've seen that these benefits in other countries have already been delivered. We've seen that globally, we've saved about 160,000 lives every year due to the phase down of coal use, particularly happening in higher income countries, in countries that have started to reduce coal use. So we have already evidence of the enormous life-saving potential of that transition to clean fuels that could deliver energy to people's homes, reduce energy poverty, and obviously reduce the death toll of air pollution as well.
How can communities be supported in delivering critical resources and protecting public health as the climate change?
So one of the big encouraging signs that we see in the report, and we explore this in the report a bit, is how much of climate action is being driven by local communities, how grassroots organizations are rising to protect the health of their local communities and are delivering change, even if sometimes governments are playing against it. And we see a big growth in engagement also from people on the links between climate change and health. So there's a lot that could be done from the bottom up. For example, when possible, people can choose healthier diets that are more plant-oriented with less saturated fats, less ultra-processed foods, can help save up to 11 million lives each year, and can also reduce the emissions that come from the agricultural sector that is kind of contributing to about 1/3 of all global greenhouse gas emissions. So personal choices can make a huge difference whenever those are available. We also see that people have a huge power to change the way that they use energy in their homes, can choose to walk, cycle, or use sustainable forms of travel instead of private vehicles whenever those are available. And importantly, particularly in countries that are democracies, people have a huge power to choose the representatives and to demand that the representatives enact change through their vote and through their engagement with local governments. There's a lot that can be done from the bottom up, and we know that most of the things that can be done are great for people's health and would improve their well-being as well.
So you have produced a lot of the reports. What are the reactions from the government? Governments are taking it seriously or just ignored?
Well, we've seen various responses from governments to the data. There's some governments that listen to the data and are concerned about the findings, particularly when they see how much it's affecting their local health, how much it's affecting their health systems, the burden of climate change on their economies and on the systems on which local well-being depend. Some governments have taken our data and used it as a foundation to inform their climate policies. We've seen our data being taken up, for example, in drafting the nationally determined contributions of some countries, particularly focusing on how climate action could improve health and how we can maximize those benefits. However, we also see big concerning trends of many countries turning their backs on climate action and on the evidence that shows how beneficial it is. One of the clearest examples is now in the US, where the government is turning its back on climate action and going through this drill, baby drill policy in which they're expanding oil and gas production plans to the detriment of us all. And from Argentina, we see our government doing the same. And those trends are very concerning. But on the other hand, many other countries are stepping up. China is expanding its renewable energy capacities enormously. And as I said, I know that India is also doing efforts to expand its renewable energy grid, which would be really beneficial, particularly because of the size of India and the fact that definitely that economy will grow and will become one of the big contributors also to climate action.
Thank you. These are my questions.